Okay, well, it's February. Look at that heart, which means it's National Heart Health Month. And who better to talk to us about our heart health than our favorite cardiologist, Dr. Kohli. Dr. Kohli, it's great to see you.
Hi, Danny. Happy Heart Month.
Happy Heart Month. Did you like that little heart wipe we got going?
Loved it.
I loved it too. You gotta love all of that. Well, I want to talk about this because every February we discuss heart health, and this is something that obviously is incredibly important, but February seems to be the month that we are really focusing on here. So tell me more about Heart Health Awareness Month, what we need to remember in February.
So the idea here, Danny, is to really put a spotlight on heart health because we don't think about it early enough. And statistically speaking, it's the most likely thing that's going to happen to any of us because heart disease is the #1 killer of men and women, and heart disease has been increasing in recent years. And yet it makes me sad to say that 80% of heart attacks and strokes are preventable with the right risk factor management. So this month is not about feeling sad. It's about taking control. It's about knowing your numbers, knowing your risk, so that you can actually modify your risk and outsmart heart disease.
Yeah, that's so huge. And again, this is something that we're looking at holistically. And hey, we can change our diet, we can change our exercise, and we can prevent this from happening to us. So let's talk about that. Is there anything we need to know that's new, first of all, when it comes to cardiology? Anything new, groundbreaking that we need to remember for our heart health?
Yes, lots of new things. So the first thing I'll say is that we need to shift that needle earlier when we start thinking about heart disease. Now, most of us think we're too young to think about heart disease, but you want to start looking at your cholesterol in your 20s and 30s because we actually start putting down cholesterol deposits in our late 20s and our early 30s. So the idea here is to get ahead of the disease, outsmart it. You know, the second is there's some new tests available that now tell us even better. They predict the future, whether or not you're going to go on to have a heart attack. So you get your usual, your cholesterol, your sugar, your blood pressure, you know, your weight, your waist circumference, but you also add on top of that a special cholesterol test called lipoprotein A. And that's a genetic test. So if it comes out elevated, it doesn't just impact you, it impacts your brothers and sisters, your children, your parents, and all the other people around you. And then after the age of 40, you can actually get an X-ray of the heart that tells you if you already have heart disease before it manifests itself. That's called a calcium score.
Oh my gosh, those are great. And I love too that, you know, not to be those people who maybe don't look, but if our brother, sister, mom, dad, somebody does end up getting a test like that, they can come back to us and say, hey, you need to watch out for this too. That's huge. Let's talk about that prevention factor. What do we need to think about when it comes to our diet and our exercise to make sure that we are, you know, preventing anything that could happen later on?
I mean, so important. These two things contribute to heart health. So for diet, there's two types of diets that have been shown to improve your heart health. The first is a Mediterranean diet, which you may have heard of. It's kind of whole grains, whole foods, legumes, beans, you know, really trying to enrich your diet with the right types of fats. And the second is something called a DASH diet, which is keeping your sodium content low. Dietary approaches to stop hypertension. Now, it sounds tricky. I would say take every plate, cut it in quarters. Half of it is fruits and vegetables. A quarter is a lean protein, you know, chicken or fish or tofu. And a quarter is a whole grain, like brown rice or quinoa. You do that breakfast, lunch, dinner. You're essentially following those types of diets.
And that's a pretty plate.
It is a pretty plate.
I love that. Let's talk about exercise too. What things do we need to be keeping in mind for our cardiovascular health?
So the kind of general rule of thumb is 30 minutes, 5 days a week. And I personally have a rule that's called the 20-10-5 rule. You ready for it?
Yeah, let's go.
Okay. So 20 minutes of cardio every day, 10 minutes of weights or yoga, core strengthening, Pilates. So whatever you like, but something to actually build muscle and make your muscles more effective at picking up the glucose, increase our strength, and then 5 minutes of meditation. So you do the 20-10-5, that's 35 minutes a day. Not a huge commitment. And it really incorporates all the types of exercise that we need to have in our life, including a little bit of mental health. We just heard the importance of mental health.
Exactly. That's huge. And I really like that. Again, that is so easy to digest and easy to do. So huge. Okay. In the last 30 seconds or so, what can we do to ensure that we're getting ahead of that cardiovascular health? Just small steps, something little that we can do every day. You say that 35 minutes maybe?
I think the 4 pillars: eat, sleep, move, stress. So 7 to 9 hours of sleep, eating that nice looking plate, moving like we talked about, and then keeping that stress and meditation under control. And then I'll leave you with going to the American Heart Association's website and calculating your life's Essential 8 score. This is your own little personalized score. It tells you what you're doing well on, what you're not doing well on, what you could do better.
I love that. Okay, I got to do that after this segment. That is actually huge.
I'm going to ask you about it later.
You absolutely better. And keep me accountable, Dr. Kohli. I got to stay accountable here. Thank you so much. It's so great to see you.
Great to see you, Danny.
All right, guys. And if you have any questions for Dr. Kohli, send us an email. It's mycoco@9news.com and put Kohli in the subject line. We love to hear from you guys.